Good afternoon, everybody. Welcome to the first in what is a planned series of online events called From the Frontlines, organized by Life Science Cares to showcase work being done in the community by our partners in this time responding to COVID-19. For those of you who don't know me or don't recognize me because I have makeup on for the first time in a month, my name is Sarah McDonald. I'm Executive Director of Life Science Cares, and I'm joined here by friends and supporters of ours from Biogen, as well as our partners at Boston Healthcare for the Homeless. I want to lay a little bit of groundwork about how we got here just briefly before I turn it to our guests today. Life Science Cares, as many of you know, 3 weeks ago today decided to jump into the fray to make an effort to combat COVID-19 the way we could, which is to rally the industry to donate and support organizations on the front lines in the pandemic. Since 3 weeks ago, we have raised $1.5 million. We have made grants of approximately $500,000 into the community. That money is already being deployed to help organizations like Boston Healthcare for the Homeless and others do the work that they're doing in real time right now. We'll talk at the end of this conversation about what's next and how you can help. But in the meantime, I would like to welcome Dr. Kate Dawson, a neurologist who came from Mass General Hospital to Biogen 16 years ago. She is Senior Vice President and head of the Therapeutics Developmental Unit that covers all of the emerging focus areas of development for Biogen. Kate also happens to be chair of the Biogen Foundation, which has made a generous contribution to Life Science Care's COVID-19 fund, and she served on the board of the Biogen Foundation for 5 years. Kate, I will turn it over to you.
All right, thank you. So it's a pleasure to be here at this first webinar, and thank you, Sarah, for that introduction. And thank you all for joining us at such an important time. I think we all have our different and unique stories about how our lives are being impacted by COVID-19, both personally and professionally. And while it may be eye-opening for many of us to navigate what we are collectively calling the new normal, we know there are so many people in our community and across the world that are severely impacted and struggling to get through the crisis, struggling to feed their families, pay bills, and obtain the healthcare services they need. Thank you, Sarah, and a big thank you to the entire Life Science Cares team for all the work you are doing on behalf of the life sciences industry to address poverty in the greater Boston area, particularly in light of this crisis. Biogen is proud to be a member of the Life Sciences Cares community, and the Biogen Foundation is gratified to support your work, and we are humbled by what you and your teams do every day. Our CEO, Michelle Benatzos, is on your board of advisors, and many of our employees are active volunteers supporting a number of nonprofits you serve in the greater Boston area. As chair of the Biogen Foundation, I am very proud of the support we were able to provide for COVID relief efforts. So far, we committed $10 million to support 3 key areas: immediate relief to our neighbors to address the needs for food, shelter, and cover expenses for basic needs; easing the burden on healthcare systems by providing protective equipment and support for frontline health workers; and expanded COVID-19 testing outside the healthcare setting. Our approach has been local fed, meaning we are supporting local community organizations because we feel we can help them mobilize and expand their existing efforts faster. For example, we were one of the very first to partner to help the Greater Boston Food Bank purchase much needed food and expand delivery services ahead of the spike in demand. In total, we have given nearly $4 million to the greater Boston area. In North Carolina, where we have a large manufacturing facility, our grant to WakeMed, a group of 3 hospitals and 8 outpatient facilities, essentially allowed them to turn on mobile testing overnight. We are also supporting COVID-19 relief efforts in countries around the globe, including helping hospital systems clean and sterilize patient transportation vehicles, expanding testing, and supporting the basic needs of frontline healthcare workers. We are particularly in awe of the work Dave, Colleen, and the team are doing at Boston Healthcare for the Homeless program to support those in need across Boston and how they are providing care for the homeless population, a population that has seen a growing number of people affected by COVID-19 over the past few days. BHCHP has a long history with Biogen, and this past year we were excited to have them participate in our annual Day of Service, Care Deeply Day. We are absolutely grateful to organizations like Boston Healthcare for the Homeless Program and to frontline healthcare workers who are working tirelessly to treat and test and prevent the spread of COVID-19. We recognize they are stretching their limited resources to provide support to those people with the greatest needs. At this time, I'd like to welcome Dave Munson, who is the Medical Director of the Respite Program at the Boston Healthcare for the Homeless Program. Dr. Munson practiced community medicine at the Kraft Center for Community Health Leadership, where he sought to understand how homeless people use hospitals and how their transition to the community could be improved. He has worked as a physician on the BHCHP's street team and now his work is focused on providing clinical and operational oversight for the program's 124 beds of medical respite. We look forward to learning more about the great work he's doing and his team. So welcome, Dave.
Thank you, Kate, and thanks for the introduction. I was just reflecting on it and how sort of all job descriptions have kind of gone out the window here in the past couple of weeks. But thanks everyone for taking some time to join this afternoon, and just wanted to share a little bit about what we're doing here at Boston Healthcare for the Homeless Program. It's really sort of upended our entire practice over the last month, as I think it has for many folks across the city and across the country, and across the world for that matter. So just for a second to frame our program for you all. So, you know, we're a community-based health center that's charged usually with providing the medical and mental health care for the homeless men, women, and children in the greater Boston area. We do that in an outreach model where we have about 40 or so different clinical sites across the city that provide medical care for folks, including 2 hospital-based clinics. And that's our usual model. And we run 2 respite programs, have a big Suboxone practice and hepatitis C practice, but all that's really changed in the past month or so. I wanted to highlight 2 specific things about homelessness that make this COVID-19 a particular challenge. One is that, with folks living in shelter and staying in groups together on the street, a lot of the social distancing and physical distancing practices that we have adopted in the past couple of weeks are really difficult, if not impossible, for homeless folks to practice. So, imagine Pine Street Inn with 450 guests in the inn. It's just not really practical to space those people out in a way, to observe the 6 feet of distancing. So you could sort of imagine that. And then the other piece, which I think has had us particularly concerned, is that we know that the rate of underlying medical illness, whether it be asthma or other lung diseases or diabetes or heart disease, the pre-existing conditions that seem to make some people more likely to have a very severe course of illness from COVID-19, we know those disease processes are more prevalent amongst our patients. So those 2 things, I think, from the beginning, really going back into early March, had us quite concerned about how this was going to play out in Boston. And I want to sort of walk you through some of the steps that we've been taking over the past few weeks to sort of try to address that need. The first thing to talk about, and we could, Sarah, if you want to go to the next slide. So we sort of undertook initially this really large project around trying to screen folks for symptoms at the front doors of the shelters and the front doors of our clinical site. So we have one main clinical site in the South End here in Boston, and then working with our shelter partners to screen everyone coming in the front door of the shelter. So we developed our own screening tool, enlisted clinical staff, sort of reapportioned staff that are usually doing case management to do some of the screening at the front door of our clinic, and then worked with the shelter partners to screen folks with the idea that we would hopefully try to catch folks that might be symptomatic before they came into the shelter and sort of pluck them out and determine if they warranted testing. I'm sort of laughing to myself because the situation has been so dynamic that when we first kind of did this, we didn't know how we were going to test them. That's become a little bit less of an issue now. So as that screening process had rolled out, we correspondingly developed a testing process. So, you know, while we are surrounded by academic medical institutions in Boston who are doing their own testing, I think we felt like we needed to come up with a way to test our own folks internally so that we could sort of declutter the emergency rooms. And we just know that our patients do better with us than they do in some of the hospital settings for a number of different reasons. So we came up with our own process for doing that. And you could see on the previous slide, we have these like testing booths, which were basically like almost ticket booths kind of thing, where, you know, basically it provides an environmental control for the person who's doing the testing to stand behind, and then they're in their personal protective equipment and they're able to test the patient or patients that way to get done what needs to be done. And then we were lucky, we have been lucky in the past few weeks, 2 weeks or so, that the Department of Public Health has been willing to run all of our tests at their state lab in Jamaica Plain, which has allowed for a quite faster throughput time, down on the average of about 24 hours or so, which, and I think just to highlight on the testing, what has become really important for us is that throughput time on the testing, because as we'll talk about in a minute, our folks have no place to go while they're waiting the test results. So they can't be in the shelter, and there's no other, we don't want them to necessarily be in the hospital just because they might have COVID-19. So they need a very specific isolation space for that. And so we kind of quickly, as we were doing the screening and the testing, realized that we needed to come up with a space for isolation. And that was on the next slide here, we can see this kind of concept of tent medicine. And I think this was, you know, just to take half a step back, this was a really, really cool partnership between our program, the Public Health Commission, Suffolk Construction and Mass Design, which in the process of really, you know, 2.5 days, took an idea, which was how do we create space for isolation, so for people who may have COVID-19 and need a space to wait while their test results, and a space for quarantine, so people who may have been exposed to people who have COVID-19 and are just sort of waiting to see if they become ill. How do we create those spaces in a very short amount of time in a safe, dignified way? And so they developed these 2 tents. So there are 2 tents which have subsequently merged into 1 tent, but that's a different story. 2 tents behind one of the main shelters in Boston, where there's 16 beds for isolation, so for people who have symptoms of COVID but are awaiting a test result, and about 22 beds for quarantine, so people that have just been exposed or in close contact with someone who's known to be a positive case. And this was an entirely new, you know, we do a lot of, you know, we practice in a lot of unique places at the HCHP. We have a street team and, you know, practice in the jail, practice in all the different shelters. This was a new thing for us. I don't think we'd ever created a new facility that we've then staffed and figured out how to operationalize in such a short period of time. But that's what the need was, and we were able to, I think, respond to that pretty well. So I think on the next couple slides, we have some examples of what it looks like in the space. And the idea, at least in the isolation space, was to create an approximation of somebody's own room, with the idea that we really didn't want people sharing space or rooms or bathrooms with other people, because we weren't sure who was infected and who wasn't in this period while we're waiting for the tests to come back. So you know, you can see that there's a cot, and there's electricity, and there's the little basket there which has vital sign machines, and this really all came together in about 2 days. It was sort of the brainchild of our CEO and our chief medical officer, and then working with the construction folks to develop these pretty sturdy tents, which then, of course, there were like 2 thunderstorms the first couple of nights that we had this, but they all stood up together. So this was a pretty cool thing that was put together that was able to, I think, serve that need. And then on the next slide, I think there's some pictures of, you know, just some creative ways, and the paper bags are like, how do you, you folks are aware of the sort of the general PPE shortage that we have. And so we've been coming up with some creative ways to reuse and extend the use of the PPE that we have. So the paper bags are there to you can store the mask while someone's taking a lunch break or something like that. So just a really, the tents were a really kind of neat way to respond to the need that had come up. And then we, in addition to, and then just some of the great staff that have been in there. And I think, again, people that have been reapportioned from clinical work in the clinics or case management work in the outreach setting, and bringing folks in. And this is stuff that had to be staffed, 24 hours a day, 7 days a week, with clinical and non-clinical staff. In the course of a few days, and people are wearing PPE while they're in the patient space. It's really been remarkable to see it all come together. And I will also say that the patients have been remarkable. I mean, it's been, it's quite a disruptive place for them, potentially, and foreign, and they're sick. They don't really know if we don't really know when someone's diagnosed which kind of sort of way they're going to go in terms of the severity of illness. So I think there's a fair amount of uncertainty and anxiety amongst the patients. But folks have just been tremendous in terms of the attitude and sort of spirit of staff. So it's been really cool. So then what we've done, in addition to the tents, is we've stood up 2 facilities, and soon to be a third in short order, to take care of people who have confirmed COVID-19. So again, the challenge amongst people experiencing homelessness is that even if they have very mild illness, COVID-19, they in Boston really can't be in the shelter. And so we need to find a place for them. And obviously, the hospital is not the place, especially for folks with mild or moderate illness, because as we're aware, the hospitals are quite concerned about capacity. So we needed to create spaces for our folks who were not sick enough, need to be in the hospital to be. And so we did a couple of things. Our medical respite program, the Barbara McGinnis House, is the 3rd and 4th floors of the building where I'm in right now at 780 Albany Street. We converted the 3rd floor into a COVID-only ward, where we've sort of created the necessary setup so that staff can be protected in that space, so that the patients and the staff are isolated from the other patients on the 4th floor and the other administrative and clinical activities that are going on in the building. And we have dedicated staff that's working in that space. And there's this is a picture of just some of the processes for taking on and taking off the personal protective equipment. And we sort of put up these plastic walls because there is some sort of business. It's not really business as usual, but there's some non-COVID work that's continued to go on here at Healthcare for the Homeless. And the 4th floor of our medical respite program is continuing to take non-COVID patients from the hospitals or from the shelters who need the level of care that we provide. So we stood that up. And then I think, I know I was sort of taken aback by, you can go to the next slide, please. The slope, the rate at which the number of cases sort of overwhelmed us. So we have had almost 200 cases amongst homeless people in Boston. Those have all been diagnosed in the last week. And so that sort of greatly outstripped the initial sort of supply of beds that we had. So we needed to find another place. And so working with the Public Health Commission, there is this, it's a previous hospital, the KINDRED Hospital, which is out in Brighton, 1515 Comm Ave up on the hill, close to BC and close to St. Elizabeth's Hospital. And in the space of a week or 2 weeks, a week really, the construction, they sort of stopped all the renovations that were happening, cleaned it up, and we moved 85 patients in to initially as additional sort of isolation space, but then quickly we needed additional space for patients who had confirmed COVID disease. And so that has been operational for about 10 days or so, filled up with COVID-19 patients who don't need hospital level of care. And again, this was just a tremendous undertaking in terms of staffing 24 hours a day, coming up with whatever the care model is going to be out of thin air. At least at McGinnis House, we've had a care model for 25 years that we've honed and adapted. This program literally came online in 10 days, where they had to figure out, how does everybody get fed, and how do you get the clean stuff in and the dirty stuff out, and how do you keep the staff safe, and what about medications and all those sorts of things. But all people that go into substance withdrawal when they come into a facility like this. So it's a pretty remarkable undertaking that doc on our street team, Kevin Sullivan, and Gloria Batista, who's a nurse at one of our clinics, sort of took on and really built this program out of scratch in a short amount of time. It's been really, really impressive to watch that because there was no other place for these folks to go. And now, because again, the need has outstripped the supply of beds, we have been working with the state and with Partners Healthcare to stand up 500 beds in the convention center. That will be sort of the same idea for homeless folks who have a level of illness that are confirmed to have COVID-19 that don't require a hospitalization. So, and this, I think I'm trying to find silver linings where I can these days. So one of the really neat things with this has been watching the construction and the trade folks put this space together in no time, in 3 days or something like that. And they put they put 500 rooms, 500 patient spaces, rooms, and the sort of support space that's needed. And these are, I was in there on Tuesday, and they're like double plastered walls. It's like, it feels like a legitimate, somewhat dignified space, which is really, really nice given the circumstances. And so we're going to do the clinical care in there starting tomorrow on that side, the 500 beds, figuring out what the care model will be, figuring out all the logistics and the details that come from that, again, out of thin air. But one of the things that's been, and some of you know our program a little bit, we've always been really good at, we're nimble and flexible and being able to adapt to what the needs are. And so I think that's helped us over the past couple of weeks where, where the need has come up and sort of in many ways overwhelmed us. But I think we've been able to, come up with a pretty good response to address things as they come. And we'll just kind of see. I think the next few weeks are going to be interesting because, we're just at the point now where we've diagnosed a number of people, a lot of people, 200-300 people. And so I think we have not yet seen a lot of severe disease amongst our patients. There have been some people who've been hospitalized, but there has not been a tremendous amount of, I would say most of the people who have been hospitalized recently, the last few days, have been because this facility hasn't come online yet. But I'm really interested and a little leery of what the next week or so is going to foretold in terms of the severity of illness that may develop, given the underlying comorbidities of the patients that we have. I know the group that's in McGinnis House, I was in there on the floor yesterday, and the average age is probably in the mid to late 50s, and almost everyone has some comorbidity, diabetes, heart disease, hypertension, something like that. So lung disease. So I'm a little worried about how that's going to go. But we'll just kind of have to see, and that may, we may kind of be forced to provide levels of care that we're not always used to doing, but I'm confident we'll be able to kind of step into that if we need to. So, all right, this is the time when Colleen asks for what we need. So, thank you guys.
Thanks, Dave. And first can you hear me okay? Just want to make sure I am muted correctly. So I wanted to give a huge thank you to everyone at Life Science Cares and the Biogen Foundation. You've been so supportive of us even before all of this happened, but to the amount you've stepped forward in this time of crisis is so critically needed and very, very much appreciated. And your leadership around building awareness of what's going on in the ground and how this situation is affecting the most vulnerable in our community. It means so much to us. And we are, as much as we're bringing all of our expertise and everything we can do to the front lines, it's obviously having a huge impact on our program. Life as we know it at BHCHP is on hold, and it's all hands on deck with this, with confronting the pandemic. And we do know it's going to have a huge financial impact on our program. So Life Science Cares and Biogen Foundation, thank you so much for helping us with that. And there's so many different ways that people can get involved at this time, whether it's through financial support to help us get through this time. As you can see, the donation of personal protective equipment, which Dave kind of pointed to, has been a shortage for our program, and we know we're not alone in that. But any needs that people have in terms of donated items, like the ones that are listed, we would love to have the chance to follow up on that. And for folks who aren't able to necessarily give financial donations, there are ways that you can give to meet the tangible needs of the patients we're serving. We have wish lists that we have up on Amazon of all different items to meet the basic needs of patients, so things like underwear and toiletries. To what Dave was kind of pointing to was, for anybody going through a period of isolation can be really challenging, and we're trying to do everything we can to make it as endurable and comfortable as possible. So even having things like ways for people to be active, patient activities, so everything from game books and coloring books and colored pencils and things like that. There's so many ways that people can help. And again, I applaud Life Science Cares for drawing attention to this, and we'll make sure that all of these opportunities are in Sarah's hands to share with everyone. But thank you all for supporting Life Science Cares. Know that our partnership with them is so valued and is making a huge difference. And please feel free to reach out to us if you have any questions, either about what we're doing as it's kind of evolving by the day, or ways that you can help.
Thank you so much, Colleen, for joining us today. And thanks to everybody who took the time to listen. We are going to make sure that we have all of the ways you can help updated on our website, lifesciencecares.org. And there are a number of other ways there that you can support, not just BHCHP, but all of our partners who continue to serve our most vulnerable neighbors in the community. We are continually adding opportunities for folks to virtually volunteer to support our organizations from the comfort of your own home. We have launched a cleaning supply drive from one of our partners, Caspar, for anyone who is local to the Cambridge area and can make a contribution at 300 Tech Square. And we are starting to work with a lot of companies who are getting creative about things like catering that they've already committed to, and making sure that since their employees aren't at work to enjoy that the meals are reframed and gotten to an organization that can use them right now. So if you can think of it, we can help you put it to good use, and we will continue to keep you updated as the needs evolve and as the work evolves. Mark your calendars. We will convene again next Thursday at 3 p.m. Next week, we will hear from our friends at Food for Free, who continue to provide their services in home delivery and food pantry deliveries to make sure that folks have access to food, but have stepped up in a huge way to increase their services and serve Cambridge residents and Greater Boston residents in a way that they've never done before. So we really appreciate your time. Please check out lifesciencecares.org for ways you can help. And I want to thank Dave, Colleen, Johanna from the Biogen Foundation, and Kate for joining us today. We will be in touch very soon. Thank you for your support. Bye, everybody.